All right, well, let's go ahead and dive in. So welcome everybody to the COVID Town Hall. Thank you so much for joining us today. I did not know it was National Tell a Joke Day, but I already feel like my spirits are lifted after these last 5 minutes. So I hope that the rest of you also feel the same. Um, but yeah, before we jump into our agenda, we're going to have Marco give us some opening remarks. So Marco, I'll go ahead and hand it over to you.
Thank you, Danny. And thank you, Peter Hajokis, ending us with a great joke. I really appreciate everybody joining in on National Tell a Joke Day. The only way I found out we can give kudos to our great marketing team, it is our most current post on Facebook. So if you're not one of our Facebook followers, you get a lot of great information joining us on Facebook or following us on Facebook. So thank you to all of you for joining us today. Good afternoon and almost noon, everyone. As you all know, I am Marco Giordano, your CEO, and I am glad and very thankful to be with you all here today. My thoughts, prayers go out to all those that have been impacted in our extended community by the earthquake in Haiti, as well as the unrest in Afghanistan. Join me this week, and as we move forward and really keeping these communities in our thoughts and prayers, much like the virus, the events of the past week in Haiti, as well as in Afghanistan, will cause these communities as well as ourselves to continue to pivot, adapt, and adjust. So, I spent some time this morning watching our past two meetings via video. So thank you to our support in capturing our discussions over a period of time. And as we go in today, and I think back, 4 weeks, 6 weeks ago, wow, so much has changed as we continue down this path together. COVID-19 continues to require us to pivot, adapt, and adjust. Not only at our work, but throughout our daily lives. As we all heard last week from Rebecca, the Delta variant is much more contagious as the original strain and has had a very significant effect, resulting in the need for us to continue to modify our protocols. So we've done that and we continue to do that. And I'm hopeful at this moment, everybody is very much aware and understands what our current masking protocols are. Really, masks are now required again indoors in all settings, whether you're vaccinated or unvaccinated. We've also begun to pivot in a way regarding the vaccine, and we are now requiring the vaccine or a weekly series of testing for all of our health center staff. And we are currently evaluating how we will pivot our approach moving forward for the rest of the organization. And as we've said all along, and as we've done all along the way, RHD will continue to follow CDC guidelines and CDC recommendations, and we will adjust our protocols as the need arises. But I think it's also important that we're not forgetting, and we continue to understand those things that we have also learned along the way, as we also continue to understand what we need to do differently as we all continue to adjust. And, the first, you all probably can guess what I'm going to share with you, and that's our 4 W's. And remembering that we continue to embrace the washing of hands, wearing masks, as well as watching your distance and waiting on gatherings, that is a way for us to continue to adapt to COVID-19. But we've also learned the benefits of the vaccine along the way. And I pulled the following statements from the CDC website, so bear with me here. And some of which we all covered last month when Rebecca joined us, but I think worthy of repeating. The COVID-19 vaccines are highly effective at preventing severe disease, hospitalizations, and death, including against the Delta variant. Unvaccinated people remain the greatest concern. Although breakthrough infections happen much less often than infections in unvaccinated people, individuals infected with the Delta variant, including fully vaccinated people with symptomatic breakthrough infections, can transmit it to others. CDC is continuing to assess data on whether fully vaccinated people with asymptomatic breakthrough infections can transmit. However, the greatest risk of transmission is amongst the unvaccinated, who are much more likely to contract and therefore transmit the virus. Fully vaccinated people with Delta variant breakthrough infections can spread the virus to others. However, vaccinated people appear to be infectious for a shorter period. The Delta variant seems to produce the same high amount of virus in both unvaccinated and fully vaccinated people. However, like other variants, the amount of virus produced by Delta breakthrough infections in fully vaccinated people also goes down faster than infections in unvaccinated people. This means fully vaccinated people are less infectious for less time than unvaccinated people. Again, those were just some statements that I pulled off of the website, CDC website this morning about the vaccination relating to the Delta variant and in a sense, the efficacy of the vaccination, the vaccinations that we currently have in play. The last thing that I wanted to surface, because I think it's critical and will be covered as part of our agenda today as we move forward together, is that we learned that while we are all in the same storm, we're all in different boats. And with that, again, let's make sure that we are intentionally kind to each other, because you don't always know what someone else is experiencing. So as we continue to pivot, adapt, and adjust together, let's continue to hear your questions. Let's continue to hear all of your concerns. We need to hear your voices as we together ensure the health and safety of each other, the people we support, and our families. So again, let's stay on this track together. Let's continue to figure out what we must do together. And with that, I'll turn the mic back over to Danny, and he'll get us started through our agenda. Thank you all for joining us today.
Thank you for your remarks, Marco. So Sarah, if you wouldn't mind pulling back up the agenda so folks can read along with us. Perfect, thank you. So like Marco was saying, we encourage you to ask your questions really at any time throughout this meeting. And as always, you have various opportunities to ask your questions. So you can submit them anonymously using your voice or by emailing the COVID-19 inbox. And Sarah will be monitoring both of those. You can also type in your questions in the Zoom chat box, or you can raise your hand, and we'll have Christy monitoring the chat. So our agenda for today, we'll have Stephanie giving us an update on protocols and just COVID-19. Then we'll have Sandy providing us an update regarding the medically fragile population. Then Pam will introduce something new called Pay It Forward. And then we'll move into the Q&A section of our time together today. And we'll hand it back to Marco after that to close the meeting. So with that, Stephanie, I'm going to pass it to you and you can kick things off.
Thanks a lot, Danny. Hi, everybody. I am coming to you as a fairly poor substitute for Brian and June, who are having some well-earned vacation right now. The COVID protocol update will not be long today. What I want to share with you is that to the extent that the protocol and requirements have shifted, and you have not seen a shift in the protocols that have been posted, it is likely because we were already doing what the shift required. So we have a number of occasions where the CDC provided updates and standards changed and protocols changed, and we did not need to change the protocol because of the work we do and because of the kind of organization we are. Those protocols were already in place. In addition, as I was looking through and preparing to talk with you today, it occurred to me that there may be some of you kind of put together the same way I am. And in that manner, what I am suggesting to you is that for some folks, waiting for bad news like protocols can create anxiety. For those of you who fall in this category, I recommend to you the CDC website. Sometimes if you are confused about the protocols RHD has put in place, if you are anxious because you're waiting for the next shoe to drop, when are we going to be shut down again? And there's so much talk about it everywhere that those empty spaces in knowledge can sometimes create anxiety just in and of themselves. I encourage you to go on there. I will tell you that the CDC website has improved vastly since last March when they first began to realize how much new traffic they would get. It really does speak in layperson's terms in ways that those of us who are not healthcare professionals, can understand. And I will share with you, and I don't think anyone would begrudge this piece of information. We have brilliant healthcare minds at RHD working on this and attentive to it and reviewing protocols. And they will tell you as well, to the extent that there is anxiety, we are all in this together in terms of no one already knows everything. So if you are finding difficulty in understanding a protocol or the application of those protocols, please don't hesitate to reach out to either the risk department or safety@rhd.org so that you can get information. In terms of what to keep an eye out for, those medical minds I just mentioned, they are going to keep us up to date in terms of the Delta variant. Just remember the most recent protocols where we're now asking that we all return to our masks. And again, it may help you feel a little better about it if you understand what's going on out there. We are wanting vaccinated folks as well as unvaccinated to wear their masks. So that is the most recent large change. Welcoming questions, welcoming email, and hoping that getting these updates and getting this information about protocols in some way helps to lessen the anxiety that we all feel in this new and uncharted territory. Thanks, and I'm going to give it, I guess I'll give it back to Peter because I'm not sure who's next.
Yeah, I can jump in, and we'll actually hand it over to Sandy, and she'll give an update on our medically fragile population. Sandy, I think you're muted.
Good afternoon, everyone. Hope everybody is having a decent day so far. I just want to sort of, I guess, piggyback on what Marco and Stephanie are saying, and just to remind folks that safety is first and our primary goal. As a values-driven organization, we try to consider individual preferences, beliefs, and choices. In reference to the medically fragile, we have a population, and a lot of you are already taking care of individuals that have medically fragile conditions. And so we're talking about the senior population, and we're talking about folks who have various illnesses that's being treated and so forth. So we are working on a protocol around these individuals that we provide services for. I mean, we need to be safe, period, but I think having those extra precautions for the folks that we provide services to, I think is probably paramount. And so just so you know, the vaccine committee is we're still working together. We're still monitoring the various states, and we're looking at any kind of news that comes out from funders or from any kind of news organization in all the states. We have a representative from every state who meets with us. And so if there's ever questions that you might have, please go to your representative from your particular state. And, I just want to add a thank you, a continued thank you for all the hard work you guys are doing and how you're keeping RHD in quality shape. It's very important. And I just want to thank everyone for your hard work. Danny.
All right, thank you, Sandy. Now we'll pass it over to Pam to talk about Pay It Forward.
Hi, everyone. Good afternoon. I'm Pam Kazanets. I'm a clinical director in the Behavioral Health and Housing Division and a member of our Clinical Quality and Innovation team. I mean, just to underscore pretty much what everyone has said so far this meeting, if there's been one constant over the past 19-ish months or so, is that things continue to change week by week and even day by day sometimes. And many of us have had conversations recently that some of the hopefulness that we felt over the past few months as more and more people became vaccinated is starting to dwindle with the rise in numbers. And I'm not sure if COVID fatigue ever went away, but it is definitely ramping up again. And then just this morning, I was in a meeting where we did a check-in and folks were talking about this. And someone in that meeting said that they read an article and they used the term emotional whiplash, which I think is a great description of just how so many of us are feeling right now. We've talked a lot about self-care over the past almost year and a half. We even did a quick survey a few months ago that asked how we all have found joy over the pandemic. And people talked about being with friends and family, outdoor activities like walking, hiking, gardening, our dogs and our cats, creativity over Zoom. And people also talked about that, how good it feels to help other people. And it's important to remind ourselves to continue to engage in those self-care activities, both as a means to try and feel good physically and mentally, but also as a distraction from the heaviness of the world. But in addition to talking about self-care and other things at RHD that have been available, like the DSIC open hours meetings, or all of the live and online wellness and well-being offerings available to staff, many of us have still been thinking, like, what else for a while now? What else can we, the RHD community, do to support each other during these seemingly endless stressful times? And a few weeks ago, in a corporate trauma-informed care meeting, we were having this very conversation. And one of the members of that committee, Tracy Thompson, who is a program specialist at Community Passages in Pittsburgh, talked about one small random act of kindness. And one of her coworkers one day left her a small note on her desk with her favorite pastry, just saying that she was appreciated. And she talked about how that totally made her day. And then that sparked a conversation about how simple it is to have a positive impact on someone's day, just by sending a text or an email, calling, leaving a note on their desk, giving their favorite piece of candy or pastry or coffee, sending a funny video, telling a joke, anything that says, I'm thinking of you, thank you, you're doing a great job, or I appreciate you. And if you've ever been lucky enough to get something like that, just think about how good it feels just to have someone reach out and say, I'm thinking of you and you're doing a great job. And how special that feels, especially when it's random and out of the blue. And also how good it feels to do something for others, knowing that something that just took such a small amount of time in your day, a small gesture, made someone feel good, maybe just for a few minutes or maybe even longer. So soon you'll be seeing communication about what I'm going to call a movement, rather than like an implementation or something else, that focus on random acts of kindness and paying it forward. And so I'm going to challenge everybody on this call to think about what that could look like. What can it look like in your team, with your coworkers? What could it look like for people that are not on this call? And how do we reach frontline workers on third shift who are even more isolated and disconnected from their coworkers? So if you have any ideas about that, you can email me, you can email Christy Katz-Freeman, you can send it to Your Voice, because we really want this to be a movement at every level of the organization. And it could just take a small group of people to commit to do something nice or thoughtful for someone else and only ask one thing in return, which is that they then pay it forward and do something nice for someone else as well. Because it's small things, and just the small things, that can make someone's day a little bit better. And sometimes it's the small things that matter most. So you will be seeing stuff about this, you will be seeing communication, and again, just really challenging you to think about it and think about how you can make someone's day just a little bit better. Thank you.
Thank you for sharing that update, Pam. I loved calling it a movement. I think that's fantastic. And luckily enough for us, this is National Tell a Joke Day, so you can get a head start and send a joke to a coworker just to brighten their day. So thanks for that update, Pam. And it's a great reminder to show a little bit of kindness to those that we work with. So those are all of the updates that we had today. We're moving now into our Q&A portion of our meeting. So feel free to submit your questions through Your Voice, through the COVID inbox, through the chat in Zoom, or you can raise your hand. So we'll go ahead and start with Sarah and see if there have been any questions that have come in through Your Voice.
Yes, I do have one. Why was COVID sick time removed after December and we are still in the midst of a pandemic? Why do you have to use sick time or vacation time when you got sick from working in the office during the pandemic? I think that should be directed toward for Alicia, I'm going to assume.
Good afternoon, everyone. COVID sick time was not removed. We always had, we've consistently, and we're still doing what we've been doing from the beginning, which is if you are using time due to COVID reasons that you are using sick time and it asks you regular or is it related to COVID? We don't have any way of knowing that someone got COVID from the office. People are out and about, they're in stores, they're moving all over the place. And so we weren't making a distinction. There's no way, and I believe June has spoken to this, you know, and Brian has spoken to this, no way of knowing 100% that where someone contracted COVID. And in fact, in some situations, we've had people that have reported that they were exposed and or themselves diagnosed with COVID, and it was in no way connected to anything at work. So we didn't make a distinction, you know, one way or the other, where somebody got COVID or whatever the case may be. I heard that as the second part of the question. But to go back to the initial part of the question, it was nothing that was removed. If you are using time for, excuse me, I'm so sorry, COVID related reasons, excuse me for that, that you are using sick time and coding them as COVID. And I think we spoke about this. My memory, first day back, is a little cloudy right now. We are trying to monitor how much of that time people are using. The only COVID time specifically that was extra was the COVID bank that we spoke about, and that people still have access to, and that has not been removed either. That is still available as long as the time, the donated time is there. that is also still available. So we do encourage people who don't have any additional time of their own left, and they've used all of their time for one reason or another, to reach out to Baroness, and I'm not sure who's managing that, but to reach out, go on the website, fill out that form, and use the COVID sick bank that is there and was created specifically for COVID. So I don't know which people may be thinking is out. We haven't changed anything on the back end administrative that we've been doing from day one. So I just wanted to make sure that that got cleared up. I don't know, Sarah, if you feel like that answered the question.
Yeah, that was helpful, Alicia.
Okay.
Thank you.
Okay, thanks.
Danny, I actually don't have any more questions at the
It
moment.
seems like maybe the only concern in the chat right now is a lot of chatter around Sheila Hall preload needing a weekly Snickers. And I do believe that it was addressed by corporate counsel Stephanie Pompey, who said, I got you. So that's the
Thank
only question
you.
in the chat. This was an easy week so far. I was nervous.
Oh, week 2 covered. Look at you.
I love y'all. Oh my God.
This is great. All right. If anybody else has questions, feel free to ask them right now. It sounds like we're already putting the pay it forward movement into practice. So this is encouraging to see. All right. Well, if there are no other questions now,
I
yeah, go ahead, Sarah.
I just got one in a private chat. Is the Lambda variant a concern at this time? I don't know who feels like they're equipped to take that.
So I would say since no one from FBCN is on the call right now.
Sheena, we're having a little bit of trouble hearing you.
Oh no, you can't hear me?
I think maybe the mic or something was not close to your mouth. If you could
Okay,
just-
can you hear me a little bit better now?
Yeah, that's good.
Okay. So since no one from FBCN is on the call, I would say that we can hold this question and either send it out in an email or answer at the next town hall. Because it is dependent, the variants are dependent upon where you actually live in the country, what's dominant where you live. So I would say we will hold this question until we have an expert. Oh, Emily. All right, someone said that Emily's here. I don't know if Emily wants to tackle this question.
Yeah, Sheena, I'm here. I just didn't want to cut in while you were chatting. Hey, everybody. Yeah, so Sheena's right on in terms of the different variants. It really depends on where they are within our country and in the world. My understanding right now with Lambda is they're starting to see it in California. So my guess is it's only a matter of time before it makes its way across the country. I think in general, we need to be concerned about variants in general, not necessarily a Delta or a Lambda or any of the other variants. It's really just practicing our safety protocols to protect ourselves from all of it, because the virus is out there, no matter what variant it is.
All right, thanks. And I think a question and answer came in the chat. Christy, would you mind reading that?
Yep, just confirming vaccinations or weekly testing is only being required in the health centers at this time, right? And Sheena answered already and said that is correct.
Yep, so I can pop in again. Yep, we are going live on Monday, August 30th with your choice of either vaccination or routine weekly testing, and also double masking, as Stephanie alluded to earlier. That should be in effect now, not waiting till August 30th, the double masking.
And if I could just jump in here, as I mentioned in my opening, it is something that we are continuing to evaluate for the rest of the organization as to what steps we would take and how we may pivot for some of the more vulnerable populations or for others within our care in regards to requiring the vaccine and or testing. So as we continue to dive into that area as an organization, again, we will be also reaching out to the community to gain additional insight and have further dialogue. But if you have other thoughts and specific thoughts around that, please feel free to share them now, share them afterwards, share them as we go down a path together, whatever you prefer.
There was a comment this is Brandon, a comment made in the chat regarding specific state mandated testing. If your state, if you're obviously you're aware of those, if you're doing those. So anything we would do would not negate what a state funder would require. So for those of you who do have specific testing requirements or vaccine requirements, obviously we're aware of those, working with you, and our risk and legal departments are aware of those variances to our normal policy. But anything we would do would not negate what is a requirement of your funder or your specific state. So if you have questions about that, please feel free to follow up with us. We can chat through those as well.
Great, thank you,
And
Brandon. Marco.
I'm sorry. I just
No.
wanted to add, I know I'm sorry, my daughter's in back there. I know a few people have been forwarding me some emails about some state-specific information of under-specific information. Please just continue to forward me those emails. I was on vacation last week, so I'm getting through everything I may have missed. But just forward them to me so I can make sure that our vaccination and COVID committee is aware of everything.
Great. Thank you, Sheena. Are there any other questions or any other comments that folks would like to make? Okay, if
Hi,
not,
guys.
as always.
Hey, Danny, this is Peter. Can you hear me?
Yes.
Hi, yeah, I just wanted to plug on behalf of Christy, who's monitoring and kind of managing the chat today, that there is a virtual well-being session tomorrow at 2 p.m. Eastern, 1 p.m. Central. It is mindfulness to support self-care. It's an hour-long session conducted by Mark DiFilippo, and I'll be producing it. Christy sent out an email this morning with registration information. You can register through Cornerstone. So if you're interested in that, please check your email. And there are, I think, a little over 12 people currently registered. So we hope to see you there tomorrow. Yeah, just wanted to plug that.
Great. Thank you, Peter.
Thank you.
Okay, well, just as a reminder, and as was said earlier, you can submit your questions at any time. Please do continue to reach out with any questions. Unless there's anything else, I will hand it over to Marco for his closing remarks.
Thanks, Danny. Thank you, everyone, for joining us today. Pam had used the words, the heaviness in the world. And I think that as we think about all that is happening in and around us, that it is extremely important for us to find whatever we can do to distract ourselves from it every now and again, whether that's random acts of kindness, whether that's like Snickers bars, or some other path that we may choose to be on, not only for ourselves, being kind to ourselves, but also for others. I would really encourage folks to look for those paths, go down those paths for yourselves, and go down that path for each other as well. We all deserve a little distraction, and we all deserve a little opportunity to laugh. So with that, I'm going to ask who I know is probably the one of the jokesters within the organization to close with us with a joke, so we all have something to laugh about as we exit, since it is National Joke Day. And Brandon, I would defer to you to tell us the last joke of this Zoom town hall meeting.
Okay, let me see here.
The pressure's on. The pressure's on.
Pressure is on. How about knock knock?
Who's there?
Woo.
Woo-hoo.
Woohoo! This meeting is adjourned. Everybody have a great day.
Y'all are sick.
See y'all.
Have a great day.
Bye-bye.